Hi, I'm Dr. Jeffrey Peretz with Resurgens Orthopaedics at St. Joseph's and Windy Hill. I'm a fellowship-trained total joint specialist and chief of orthopedics at Emory St. Joseph's Hospital. One of the most common reasons for a total hip replacement is osteoarthritis of the hip. Osteoarthritis is a condition that affects the cartilage which lines the surfaces of the ball and socket part of your hip. Other reasons for hip replacement include avascular necrosis, which is a condition that affects the blood supply to the ball part of the hip, as well as fractures. Total hip replacement is a surgical procedure that replaces the ball and socket cartilage parts of the hip with metal implants. It is one of the most successful procedures in all of medicine. Basically, what we do is replace the worn out cartilage portions of the hip, the ball and the socket, with metal and plastic implants that then serve to function more normally for the patient. This allows the patient to walk with less pain and have better range of motion and mobility after the surgery. There are multiple approaches that can be used for hip replacement surgery. I have kind of gravitated towards the anterior approach for hip replacement because it is a less invasive and muscle-sparing approach which allows for a much quicker recovery for the patient in the early post-operative period. This is advantageous because it allows us to do the surgery as an outpatient, which means the patients can go home the same day as the surgery. An additional reason that I like the anterior approach is that it does not require anterior or posterior hip precautions after the surgery. This means that the patients don't have to avoid certain movements or motions in order to prevent the hip from dislocating after the surgery. Additionally, I like the anterior approach because we utilize X-ray guidance during the surgery. This allows us to pick implants that are sized appropriately for the patient, as well as optimize leg length and implant position during the surgery.